who evaluated the elocution competition of numerous accolades and award during her career. We welcome you, ma'am.
We are delighted to have with us Ms. Sai Bala, Nursing Director, Amrita Hospital, Kochi, a passionate nurse leader with 26 years of experience, having held prominent management positions in various clinical and non-clinical areas. Her contributions are widely recognized in areas of nursing education, teaching and mentoring while upholding high standards of nursing practice. We welcome you, ma'am, onto the dais. Request the chairpersons to take up the dais. First, we'll move on to the staff category of elocution. Here comes the presenters to deliberate on envisioning future healthcare nurses' perspective. The first presenter is Monami Dan, staff nurse from CMRI Hospital, Kolkata. Over to you. You will be having 5 minutes to present your elocution. Presenters, kindly note you're expected to present your elocution for only 5 minutes.
Good afternoon, distinguished delegates and dignitaries. My name is Monami Don, and thank you for joining me today as we delve into the future of healthcare from a nurse's point of view. Before I commence, I would like to extend my gratitude to the organizers and leaders for providing me with the opportunity to be on the stage, and my institution, especially my Chief of Nursing, Ms. Vijayalakshmi ma'am, for her unwavering guidance and support. As we stand on the threshold of tomorrow, it is imperative to understand what the future of healthcare is and why it holds such significance. The future of healthcare is not merely a matter of medical advancement, but is intertwined with the fabric of our lives. We all interact with the healthcare system, shaping and being shaped by its progress. It is clear that the landscape of healthcare is constantly evolving, from technological advancements to changing patient demographics. Nurses are at the forefront of these changes, leading the way in delivering high-quality care to individuals and communities. Picture a world where technology seamlessly integrates with human touch, where artificial intelligence enhances rather than replaces the healing power of human connection. In this future, nurses utilize innovation to personalize care, integrating telehealth services along with wearable devices and predictive analytics. Yet, even amidst the progress, the timeless essence of nursing prevails. Compassion and empathy remain unwavering. Nurses offer companionship, navigating alongside patients with cultural sensitivity. Amidst global health crisis, we stand as resilient sentinels, confronting challenges with grace and agility. In this envisioned future, nurses embody hope, and through the lens of nursing, disparities in healthcare access persist, but we are capable of performing even against these challenges, casting a pall over the promise of equitable care. Yet, amidst these challenges, luminaries such as Andrea Harris illuminate the path forward. Through innovative initiatives like mobile clinics, she dismantles barriers to care, ensuring that no community is left behind in the pursuit of wellness. Furthermore, the future of healthcare demands an unwavering commitment to patient safety. In this narrative, Laura Smith emerges as a paragon of diligence, implementing evidence-based practices to mitigate surgical risks. Through her steadfast dedication, she not only safeguards the well-being of her patients, but also charts a course towards improved healthcare outcomes and fiscal prudence. In the canvas of tomorrow's healthcare, their stories serve as poignant reminders that amidst the whirlwind of progress, the timeless virtues of care and diligence remain steadfast pillars of healing and hope. 78% of the public recognize our unparalleled standards, a distinction surpassing any other profession by a notable 13 points, as revealed by the Grand Gallup poll. Valuing nurses is not just an ethical requirement, but also an economic necessity. Investment in the nursing workforce has been shown to yield high results in several areas. And another crucial transformation I aspire to witness is the active engagement of us nurses in the formulation of policies. In the evolving landscape of healthcare, healthcare will transcend all confinements, and we nurses will emerge as stalwart advocates for holistic well-being. We will champion integrative therapies, seamlessly weaving together mindfulness practices, tailored nutrition plans, and alternative modalities to create comprehensive treatment frameworks. With a focus on empowering patients to take charge of their health, we will serve as educators and mentors, nurturing a culture of prevention and wellness. Through personalized guidance and unwavering support to our patients, we will inspire individuals to become active participants in their own health journeys, fostering lasting habits and ensuring a brighter, healthier future for all. In closing, I urge you to join me in embracing this vision of the future, a future where healthcare is not just a privilege, but a fundamental human right, where nurses are not merely caregivers, but architects of healing and transformation, where nurses will be acknowledged as integral partners in the healthcare journey, transcending mere obedience to physicians' directives. Together, let us forge ahead with courage, compassion, and unwavering resolve, knowing that the future of healthcare lies not in the hands of fate, but in the hearts and hands of nurses like you and me. Thank you very much.
Thank you, Ms. Monami. The second presenter for the staff nurse category.
Thank you, ma'am. Good afternoon, everyone. I thank ANEICON for giving me this opportunity to speak about the profession I'm actually proud of. The very first requirement in the hospital is that we do the sick no harm, says Florence Nightingale, the mother of nursing. Today, we gather here to celebrate not just a profession, but the calling. Nurses are the backbone of our healthcare system, providing comfort, care, and compassion to those in need. A nurse will always give us a hope because she's an angel with a stethoscope, quotes Carrie Larty, as they are on the front line working tirelessly to heal the sick, comfort the suffering, and advocate the vulnerable. As we look at the future of healthcare, one thing is abundantly clear, that role of nurses will only grow in importance. But the future of nursing is not about just maintaining the status, but it's about empowering the next generation to lead, innovate, and transform healthcare. For example, I could proudly say that I chose nursing because it was my profession, and there are very few who could do that, because nursing is kept as a backup option rather a priority. However, past nursing and current nursing differ significantly. In the past, nursing was often seen as a subordinate role to the physician with limited opportunities, education, and autonomy. It is often believed that nurses primarily provide care and assistance to doctors. In contrast, current nursing encompasses a much broader scope of practice. Nurses now receive extensive education and training, often earning a bachelor's degree. They play an integral role in healthcare with responsibilities ranging from direct patient care to leadership to research and advocacy. Moreover, modern nursing emphasizes evidence-based practice, patient-centered care, and interdisciplinary collaboration. Nurses are increasingly recognized for the critical role in promoting health, preventing illness, and managing chronic conditions. Advanced practice nurses, such as nurse practitioner, nurse anesthetist, and nurse midwife, have expanded their roles to provide more specialized and independent care. Overall, while the core values remain constant, the past nursing and the present nursing differ significantly in terms of education, scope of practice, and professional recognition, because nurse dispenses comfort, care, and compassion even without a prescription. In envisioning the future of healthcare nurses' perspective, we stand on the brink of a new era. It's essential to recognize the pivotal role that nurses will play in shaping its course. Empowering nurses isn't about just preparing them for the challenges ahead, but equipping them with the tools and knowledge and confidence to lead the way. In the years to come, nurses will be called upon to navigate complex medical landscape, harness cutting-edge technology, and addressing patient needs. But beyond technical skills, we will need empathy, adaptability, and commitment to lifelong learning. We as nurses will embrace the technology as a powerful tool to enhance the efficiency and improve the outcomes, while never losing the sight of a human touch that lies in the heart of profession. For example, there is an argument about AI, that is artificial intelligence, that would replace nurses. But I believe it would just enhance the care, rather replace us, because we work seamlessly within interdisciplinary teams, leveraging our unique expertise to advocate for patients, coordinate care, and drive holistic approaches to wellness. With focus on preventive care and health promotion, nurses will play a central role in empowering the individuals and the communities. Furthermore, nurses will champion diversity, equity, and inclusively ensuring that all patients receive care that is culturally sensitive and uniquely tailored to their needs. In the future, nurses will not only provide care within the traditional settings, but venture into communities, schools, and virtual platforms, reaching individuals where they are most comfortable and accessible. For example, the app Practo, where doctors and nurses are available 24/7. Above all, we as nurses will continue to embody the core values such as professionalism, advocacy, and expertise, serving as a tireless champion for the healthcare and the dignity of the people, regardless of their circumstance and background. Together, we will shape a future where healthcare is not just service, but a fundamental human right. I would quote something that I have learned in my nursing journey. Being a nurse isn't about just grades. No book will teach you to cry with the patient in their pain. No professor will tell you how to explain it to the family that their loved ones are dying. No class will tell you the dignity of bed making. Nursing is not just about giving injections or pills. It's about loving the people at their weakest moments. Salute to all the wonderful nurses who gave their life for caring for others' families than theirs. So let us all pledge to empower, uplift, and support the next generation of nurses as we embark on the noble journey of healing and service. Together, we can create a future where healthcare is not just a profession, but a beacon of hope. Because a nurse is the one who opens the eyes of a newborn and gently closes the eyes of a dying man. It is indeed a high blessing to be the first and the last to witness the beginning and the end of life. Thank you. Thank you, everyone.
Thank you. We will proceed. Here comes the first presenter, Ms. Susan Mary Prabin, student nurse, Triple M College of Nursing, Chennai.
A very good afternoon to all the honorable personalities present here. I am Susanna Mary Prabin, and as a student nurse, I consider it as a great privilege to have got this opportunity to talk on envisioning the future healthcare. The time is not far when digitalization will transform every facet of healthcare. Very soon, we'll have robots doing surgeries in every hospitals. And in the future, humans might also develop artificial womb where we can grow and deliver babies. Now, all these technological advancements will surely take place in the near future, and that will transform our healthcare for a greater good. But now I would like us to ponder over certain questions. How many people will this advanced healthcare actually benefit? Will the technologically advanced healthcare be accessible to the common people? Will it be affordable to the common public, or will it be limited to the rich minimum number of people? Well, as a student nurse, I consider that future healthcare is not something that is to be limited to people who are poor, people who are rich. It is for everyone. Well, let me share with you an incident that recently happened in India. A young lady who upon noticing a small lump on her breast thought of seeking for medical help. But unfortunately, she was diagnosed, wrongly diagnosed as a case of malignancy and unnecessarily had to undergo the chemotherapy treatment for about 1 month. And no prompt medical intervention was done for her until the lump actually got ruptured. Which reminds me of another incident that took place in my own family. I had an elder cousin brother, a completely healthy individual with a sound body and a sound mind. He had no diseases. Just one small problem, a slight misalignment in his lower jaw. The doctors assured that a very minor surgery can rectify this defect, and we agreed to it. But unfortunately, we lost him to death. He died on the operation table even before the operation actually got started, just because of an overdose of anesthesia. Well, he lost his life. His parents lost their son just because of a medical negligence, which is not actually an error committed by a single person, but error committed by the entire healthcare team. According to the World Health Organization, 1 in every 10 patients are harmed because of unsafe medical practices, and about 3 million deaths occur annually because of medical negligence. And as healthcare professionals, it becomes our primary responsibility to eradicate such kind of medical negligence and the lack of transparency from the healthcare system. In 1978, the World Health Organization came up with an initiative, Health for All, by 2000. And now we are in 2024, and still that initiative remains an initiative. The objective has not yet been reached. And one major reason why it has not happened is because of the poor accessibility to the healthcare facilities. India is a country with about 1.42 billion human population, with a vast majority of people below the poverty line who cannot actually afford the private hospital facilities. Still, India has got approximately not more than 24,000 government hospitals, and in that, if we rule out the community healthcare centers and the mobile medical units, then the number of specialty hospitals is even less. Not only do we face a shortage of hospitals, but also a shortage of healthcare workers, especially nurses. Recently, a survey was conducted in 2022, and that reported the migration of about 23,000 nurses from Kerala, which is just one state in India, and that too in 1 year. And when inquired upon, the major reason was found to be the poor working conditions. Because of the existing shortage, nurses were asked to work for longer duration, and no matter however hard they worked, their pay was not satisfactory. Well, I envision a future where the healthcare will not only be technologically advanced, but will be accessible and affordable to the common people. No matter how much technologically advanced we become, if we are not able to rectify the existing defect in the healthcare system, we'll never be able to provide quality care to the patients. I envision a future where nobody will die out of medical negligence in the healthcare field. I envision a future where the healthcare system will be strong enough to support their employees, where the healthcare system will not give importance not only to the health of the patients, but also due significance to the emotional and the physical well-being of the healthcare workers who are toiling day and night for their patients. And finally, a healthcare system that gives emphasis to quality care as the basic right of each and every human being, irrespective of their economic status. Well, as a student nurse, I had the opportunity to render care in one of the hospitals, and there I saw the dark reality, the cruel reality of the healthcare system that surprisingly still exists in India. And there, literally each and every moment, patients die because of not getting prompt medical intervention. Well, for me, the need of the hour and of the future is not technology, it's humanity. What we need is sufficient and efficient doctors and nurses who can work with empathy and compassion for their fellow human beings. Machines are always machines. They can never replace the human factor. They can never replace the human touch. It's true that technology can take our healthcare field to the next level, but when that happens, let us not forget the thing that matters the most, and that is the patient. Once again, I would like to thank ANEI for giving me such a wonderful platform to talk. Thank you.
Thank you. Of Nursing, Kerala. Over to you, Mr. Anup.
First and foremost, my sincere thanks to ANEA and the chair for giving me an opportunity to speak my mind on the topic envisioning future healthcare, a student nurse's perspective. Greetings to you champions of healthcare. As a proud nursing student, I carry on the burden and the baton that my many predecessors have passed down in envisioning a brighter and better healthcare for tomorrow. Along with other healthcare professionals, we nurses too, from time immemorial, have played a vital role in shaping our healthcare, and I dedicate this speech to those changing human health one step at a time. First and foremost, as I got the opportunity to pursue nursing, I was exposed to the many positives as well as the concerns of nursing. I mean the concerns of the healthcare. So as a student, let me grab your attention to the many innovations in healthcare and some of my concerns, which I believe, along with our contributions, will change the future. First, I see a major reformation in education. What we once used to learn from textbooks will now be transformed into virtual 3D solutions and models using augmented and virtual reality. This way of learning will improve the quality of care. And this way of learning will not only improve the quality, but also how we perceive when it comes to the care. Also, I see a major reformation in the AI as well as the technology in healthcare. When it comes to AI, as we have seen, many robotic surgeries have been done that have been assisting the doctors in recent years. And I think this AI will be the next future. I also have to say there are many technologies that are taking healthcare to the next level. Some of the major examples are the new companies called Viva LNK that have proposed a new technology known as biometric tattoos that can actually transmit healthcare as well as the health parameters directly to the healthcare system. There are actually wearable sensors that can monitor health parameters, I mean real health parameters such as heart rate, temperature, and blood pressure. How much advancements is healthcare being now? There are also other concerns that I have to address, especially when it comes to geriatric and mental health. According to many surveys, especially in the USA, the geriatric population is going to increase by 20% in the year of 2030. But when it comes to India, it will increase also by 2050. And we are not that far away. But what can be done to this? I say to you, let us invest in people. Let us invest in healthcare. Let us invest in geriatric health. Let us research in geriatric medicine. Let us ask the young healthcare professionals to take on geriatric medicine, because they too are a part of our society. And if we do not take care of them, who will? Tell me people, who will? Then there is another concept, an alien concept that we are not aware of, that is One Health. This is a collaborative approach where we take into consideration the health of humans, animals, plants, and the environment, the surroundings that they are in. This cycle has been broken because of human intervention. Global warming, changes in climate have all led to this. Global warming in the very next few years is going to impact the healthcare. The melting of the polar ice caps are going to reveal some of the most notorious as well as virulent forms of viruses. COVID has been one of the examples. As you can see, when the global warming takes its effect, many viruses that was once nullified by the many factors are now getting stronger and stronger. What can be done for this? I say we have to invest in research and anything that can be done to nullify these issues. Next, there is the most important thing that we have to know. That is to put education in the front line, to give that touch of heart and love to people. Because as humans, We are the ones who are in close connection with these people, with a close connection with healthcare. And if we can't do that, who will? So let me address the big elephant in the room. What does the healthcare look like in the future? I say it looks brighter and better because as healthcare professionals and healthcare students, we know what we are going to do and we know what is the need of the hour. And the need of the hour is to rise up, is to speak up, and to be wise up. As healthcare professionals, let me ask you, ladies and gentlemen, if not now, then when? If not us, then who? If not here, then where? I would like to part my speech with a quote by Ed Millett. What you envision in yourself, how you envision the world around you want to be is of great importance because these things becomes your focus. As a proud nursing student, I carry on the burden and the baton. I know what it means to clearly think for the people and to understand what they're going through. And let me say this, as I conclude my speech, I want you to understand healthcare is of a bigger importance. And the quality of life and the quality of touch and the love that we give to the patients goes way beyond. Thank you very much.
We request the juries, if you wanted to say a word, we request you.
Thank you. Very good afternoon to all. Morning we had a nice session of debate. I'm sure that yes, the future leaders are with us and with the mindset. That is what I felt. And they felt that both the staff category as well as the student category, they felt that even though with the technology we have, even we do have the human touch which has to be sustained. It was a great presentation. Congratulations to all of you for coming up today. It was really nice to hear from you. I hope it is the same for all who are sitting here. We are proud of you. Thank you.
Jai Hind and greetings to all. Today, this session, this atmosphere, this ambience is full of healthcare and healthcare future. My congratulations to all the presenters and the speaker for their beautiful and the meaningful, their expressions. Thank you, and we wish that today they all are the part of SDG goal 3, that is health, good health and well-being. Congratulations once again. Jai Hind.
Congratulations to all of you. It was really inspiring for me. I think one point that I would really love to highlight is the students spoke better than the staff nurses. So somehow we have prepared them for the future, but as they work in our settings, they are coming down. I think their ability to read and connect to the things outside them is going a little low. I think that is where we have to focus as ANE, as leaders in the clinical settings. I would like to give you few tips that I have learned, also I use in my talks, that the use of personal examples in any elocution, if you really want to be an influencer, and congrats to you, my girl, I don't know your name, but you have done excellent. I don't think anybody, a lot of us would not be able to do what you did. The collaboration of your personal story with scientific data, the presentation of a problem which can penetrate into your heart, and the solution which includes science and humanity. That's an exemplary way of putting a point across, and I really congratulate you for that thought process, and I hope that one day you will be sitting in somewhere here guiding more people. This is the future of nursing. Thank you very much for this opportunity. I really enjoyed I don't think I'm a jury, I'm a learner in front of you. There's plenty much to learn from all of you. Nice for standing up and talking. You are the future. Thanks to all the juries for their valuable feedback and comments and for chairing the session. A big round of applause to all the presenters. The results would be announced in the valedictory session. We request the juries and the participant to pose for a photo at the photo corner.